is Jamie Lambert, and I'm here today to talk to you about the Zika virus. So my point today is clear and blunt. There is a virus in this world right now that is causing tiny heads on babies, which causes lifelong complications, and this is preventable. Again, my name is Jamie Lambert, and I work for the Florida Department of Health. There are three things that I want to talk to you about today. First, I want to talk to you about what the Zika virus is, how it's transmitted, and what the symptoms are. And then I want to talk to you about microcephaly, what it is, what types of complications and issues it can cause in an infant or a newborn. And then lastly, I want to talk to you about how you can prevent this virus, how you can protect yourself, and how you can teach others to protect themselves. So here's my note card. The first thing I want to talk to you about is the Zika virus, and that it was found in Uganda in 1947 in rhesus monkeys, and then it was found in humans in 1952. And it was found to have been transmitted from rhesus monkeys to humans via the Aedes mosquito, Aedes, and this is a certain genus of mosquito. And in Urbania, in urban America, only been found here in Florida, mosquitoes breed in standing water. And if they bite someone who is infected with the Zika virus, and then go on to bite someone else, they can pass on that Zika virus through their saliva. And then that person can pass it on to someone else through sexual contact, via blood transfusion, or in utero from mother to unborn child. Some of the symptoms of Zika virus include fever, rash, joint pain, muscle pain, conjunctivitis, and severe headache. And conjunctivitis is red, itchy eye. So again, the transmission is from monkey to mosquito to human. And you'll see this image here to tell you a little bit more about it. The second thing I want to talk to you about are the complications from Zika virus being transmitted in utero from mother to baby. It can cause microcephaly, which is when a baby's born with a head much smaller than expected in proportion to its body. And that can cause symptoms such as seizures, developmental delays, movement and balance issues, as well as feeding and swallowing inabilities or difficulties. And in addition, hearing and vision loss problems can happen. Here's an image of a normal head on a child beside a child with microcephaly, and as you can see, the difference is stark. I mean, it's just very scary. So the third thing I want to talk to you about is how this is preventable. How you can prevent contracting this virus or passing it on to someone or to an unborn child. Repellent and barriers such as long sleeves and long pants are important. Repellent, DEET is safe during pregnancy. However, certain types of repellents are not good for young children, so keep that in mind. And that comes from the CDC as well as World Health Organization websites. They do suggest to talk to your healthcare provider about those things, different types of repellent. In addition, you can repair your window screens, which prevents mosquitoes from getting inside your home. You can also use bug netting if you're sleeping outdoors or if you have a child who's under the age of which they can use repellent. In conclusion, I know it's crazy to think that a little tiny annoying mosquito can cause such grave complications in a child, but it's possible and it's preventable. So remember, use repellent and clothing barriers, repair your screens, and dump standing water, because this is how mosquitoes breed. Please share this message today. Pass it on to others that you know who may not have heard about it, because it is here in Florida. If you have questions, let me know. This is something I'm passionate about. I do work with mothers and babies every day, and this is important. So pass it on. Safe Alive.